Amara.
I'm Cami.
And I'm CK.
And we're Ely. Today we're doing our presentation on senior diet based on musculoskeletal movement and skin integrity. For today, I'm going to talk to you about senior complications, the assessment tools used, indications of poor nutrition, and then obesity. So at first we'll talk about senior complications. Impaired skin integrity increases wound healing time, increased dependency with ADLs, increases the risk of pressure sores, weakness and loss of muscle tone, increase the risk for falls and injuries, decreased bone mass, can cause osteoporosis, increases pain and depression because of the lack of movement going on, higher risk for hospitalizations, which increases financial distress along with other distresses such as emotional distress, family distress, and decreased immune system response increases the risk for infections. So now we're going to go on to the indications of poor nutrition. A few indications would include dry and brittle hair, weakness, poor coordination, an irregular heartbeat, and a large spleen, dry patches of skin. Your skin turgor will be more noticeable. And those are just a few signs. There's a lot more, but those are the main signs that you will see with poor nutrition. So now we're going to go on to the assessment tools. And normally in a hospital, you'll use a Braden Scale assessment form. And the lower the score, the higher the risk for skin breakdown. So we want to avoid that as nurses. So the more you can increase the nutrition and what's important for nutrition as a senior, it will help decrease the risks of skin breakdown. And then some hospitals and other clinics will do the MNASF form. And it's a screening tool specifically designed to quickly identify 65-year-olds and greater for their malnutrition status. And now lastly, I'm gonna hit on obesity, which is a malabsorption risk factor. And the causes are increased caloric intake. It can be genetics, lifestyle, poor diet, so an increase of sugars, a decrease in vegetables and fruits, a BMI greater than 25 increases the risk for respiratory distress and digestive diseases and some cancers as well. And then a BMI 35 and greater increases the risk for coronary artery disease, which will cause potential other heart problems along with it, diabetes, and hypertension. And those all have to do with the heart, or can affect the heart later on, so it is good to maintain a good nutrition intake. For the muscle movement, the cardiac efforts increase to perform for ADLs, making exercise, ambulation, your daily activities harder to do, less appealing. And then for skin integrity, with not enough nutrition, it can cause a lot of skin breakdown, especially with obesity because of all the folds and rolls you have. It can cause issues underneath the folds and potentially cause skin breakdown. So anything that can help your nutrition, so eating more vegetables, fruits, meats, and decreasing the sugars and the fats will help you not become obese and maintain a healthy lifestyle.
So malnutrition for seniors, senior patients are at an increased risk with polypharmacy. Polypharmacy increases the risk for malnutrition for seniors because it changes the way they eat and how they eat, and if they take in the nutrition, and if they have an appetite, and if it's a social event, or if the meal times are pleasant. So anytime you combine the polypharmacy, you have a risk for fatigue and weakness. If people are too tired or don't have the strength to sit up and eat, or they sleep through meal times, that's nutrition lost. Many of the medications have GI upset for nausea, vomiting, diarrhea, just general distress. Of course, you're not going to want to eat if your stomach is upset. Some of them are causing anorexia. So not by choice, it's just they don't have the appetite to drive them to eat properly. And then taste is a factor because some of the medications have a metallic taste to them, or just take the enjoyment of eating away. And when they spend less time eating, then they're gonna not eat as much and maybe not get the proper calories they need. Risk factors for malnutrition for seniors also includes this inverse relationship between pain and appetite. So some of the medications cause osteoporosis, and then it happens as a degenerative disease, like chronic happenings as aging, as bones and joints deteriorate, and sometimes it's difficult to manage the pain, and worsening of the disease process affects the appetite and the mood. When patients are in pain, they're gonna have less of an appetite, and they might not be getting the right vitamins. So vitamin D is needed for calcium uptake. You also need boron and magnesium. This is just one of the things I put in here. You can see that there's different nutritional intake to support your bones. Here's a little bottle of D3 that patients can be prescribed to support the bone process. Malabsorption factors for seniors also includes the increased risk for cancer and cancer treatment. So pancreatic cancer, for example, affects the improper secretions of enzymes and hormones needed to complete digestion, and they can become damaged. Intestinal or colon cancers, absorption is compromised, and procedures such as an ileostomy or colonoscopy vary because certain vitamins are produced in the intestines, vitamin K for particular, and nutrition is picked up at different stages along the intestines. Skin cancer, back to the vitamin D deficiency, and vitamin D deficiency affects your calcium absorption. Not taking in proper boron causes skin to compromise with slow wound healing. Radiation and chemotherapy, common side effects are the nausea, diarrhea, decreased appetite, and it just demotes the cell reproduction because the nutrition's not there. So this is just, polyphenols is what a lot of people read about for anti-cancer effects, particularly gastric, prostate, lung, mesothelioma. And there's a list of cells here that polyphenols address. Good ones are considered 409 milligrams per kilogram for it to have the polyphenols that assist in cancer.
I'm going to be talking to you guys about some of the different electrolytes and how it affects our bodies as far as skin integrity and muscle movement. So we have potassium, sodium, and calcium. There are several others that are important to maintain homeostasis. That's what keeps us breathing. That's what keeps our heart rate going. It's what helps us digest our food. But these three are the ones that we kind of like to keep track of most, because most people are at risk for developing either a hyper or hypo level, depending on the medications they take, depending on their hydration status, and depending on disease processes. So with potassium, it's really important that we get the right amount of potassium because it supports cell growth and neuromuscular functions. It also, if you don't get enough potassium, it can cause tetany, cramping in the muscles, rigidity. If you get too little, it can cause fatigue, weakness, So it's really important that we get our potassium. So some ways that we do that is by eating dried fruits. Raisins are full of potassium, bananas, black beans, and cooked broccoli. Those are just some options. So next we have sodium. How sodium affects our muscles is it helps transmit impulses from our postsynaptic nerves. So meaning if, let's say, you touch a hot stove and you jerk your hand away. So the sensory response in our nervous system is the feeling of the hot stove. The motor response is when you jerk your hand away. So it's important that our muscles remain flexible and able to make those quick reflexes, and we do that with the proper amount of sodium. So the easiest way to get your proper amount of sodium is through table salt. However, if you get too much sodium, it can lead to hypernatremia. And hypernatremia can cause dehydration, it can cause fluid retention, and it can also cause some muscle irritation as well as heart complications. So lastly, we have calcium. Calcium plays an important role in blood clotting. So as we know, blood clotting and blood comes from our bone marrow. We create red blood cells through our bone marrow. And so the reason calcium is important is because if we don't make enough of those red blood cells, then our thrombolytic factors, we are not able to clot as easy. So that puts you at risk for hypocalcemia if you're getting too little or too much calcium. How you get your calcium is through dairy, so milk and cheeses, yogurt, kale, spinach. Those dark, leafy, greeny vegetables have a lot of calcium in them, as well as cereals and fortified grains. So for individuals that are not able to maintain these electrolyte levels orally, there is parental nutrition, enteral nutrition, and total parental nutrition. These are essentially liquid forms of nutrients that if you are hospitalized and you have an enteral tube, either in your GI tract or through a vein. Through a peripheral vein would be parental, and through a central vein would be total parental nutrition, which is for longer term. So just remember that your skin is affected by all of this. We can reduce our bleeding and our healing time with this proper nutrition, as well as decrease swelling and edema for people with heart issues. How our muscles are affected, it decreases risk for falls because of that impact that we have on our reflexes, as well as increases blood flow. All of this should increase self-esteem for the senior patient.
Thank you for watching our presentation. And remember, your skin integrity and your muscle movement is important when it comes to your diet. Thank you.